Good morning, colleagues. Rehabilitation Social Services Committee will come to order. We have a short but important docket, and I will ask the clerk to open the roll.
Madam Chair, you have a quorum.
Thank you. Okay, we have a few house patrons in the queue, and the first patron who actually called my name at 8:15 was patron Avoli. So I'll ask the committee to please turn to House Bill 1957. And Delegate Avoli, would you like to talk to us?
Yes, thank you, Senator Favola and members of the committee. This is HB 1957. This removes a requirement that an investigation and report be conducted when a petition is filed for the adoption of a person 18 years or older. The bill simplifies procedures and provides circuit court judges the ability to exercise their discretion in adult adoption cases. HB 1957 reduces the burden on families and local DSS caseworkers. This bill allows circuit court judges the freedom to allow two consenting parties to formally become a family. If a judge has any reason to be suspicious, he or she may still call for an investigation. This bill simply removes the requirement of an investigation by local DSS. Senator Favola, I do believe that there are a couple witnesses that want to speak to the bill.
Sure, it's a very straightforward bill. I'll ask my colleagues if they have any questions for Delegate Avoli. Okay, hearing none. How many speakers do we have?
If you would like to speak to the bill, please raise your hand.
I will say I think your bill's in very good shape, so I would advise the speakers, if you want to speak, to just say you support. How many speakers?
I see 2 speakers, Madam Chair.
Okay. A motion has been made to report the bill, so I would hope that the speakers in the queue would be ecstatic. It's a very direct and simple bill. Motion was made by Senator Bryce and seconded by Senator DeStef. Will the clerk please open the roll?
Ayes 11, noes 0.
Very good. Thank you, Delegate Avoli.
Thank you, Delegate. Thank you, Senator, members of the committee.
Next, I would like to draw your attention to House Bill 2065. The patron is Delegate McQuinn. Delegate McQuinn, are you still with us?
Yes, I am. Good morning, Senator. How are you this morning?
Good morning. Good to see you.
Good to see you as well. Thank you, Senator. Senator,
welcome.
House Bill 2065 is a produce prescription bill, and based on what has happened in the House, it will be changed. The bill will be changed into a Section 1 bill, and this is so that we could spend next year or this year looking at ways to pilot this program and to establish the advisory group to pull, to identify how the program would work, how it would be rolled out, and who would be involved and engaged in this process. Originally, it was a produce bill, a prescription produce bill to identify those who would be qualified for this particular program and help them to, live a healthier life and a more affordable life in terms of purchasing of vegetables and fruits. And so at this point, I would hope it be that we will receive the support from, again, the committee to move it forward for a study. Thank you. And there are individuals who are on who would like to speak to it as well.
We will take speakers on this. I will ask them to be brief. This is a very good bill, and it's a Section 1 bill, and it is addressing something that is very important, our what we would call food deserts in some of our underserved areas. So how many speakers do we have?
I see 2 speakers, Madam Chair.
How many?
2.
2. Okay. I would like to take the first speaker. If you could keep your remarks to 1 minute, that would be wonderful.
Chelsea Bennett, please go ahead.
Good morning, Madam Chair and committee, and happy Friday to
Friday.
each of you. Chelsea Bennett with the American Heart Association, and today on behalf of the Produce RX Coalition, which consists of over 16 local and state organizations that are in support of this. Madam Chair, you said it perfectly. This is about ensuring that those individuals who are not only in underserved communities, but are also facing chronic health conditions are able to have access to fresh fruits and vegetables. This is a preventative measure, and so we do hope for the committee's support. Thank you, and thank you to Delegate McQuinn for leading on this initiative.
Thank you. Thank you for taking time to be with us. The clerk, please call the next speaker.
Lydia Nasheed, please go ahead.
Good morning, Madam Chair and members of the committee.
Good
My
morning.
name is Dr. Lydia Nashed, and I'm speaking on behalf of the Virginia chapter of the American Academy of Pediatrics in support of House Bill 2065. I'm a pediatric resident at Inova Children's Hospital, and I know firsthand the importance of ensuring children have access to healthy foods. Unfortunately, I have also seen firsthand the prevalence of food insecurity in my own patients. Children from food insecure households are likely to be sick more often, recover from illnesses more slowly, and even be hospitalized more frequently. A lack of fresh produce can lead to vitamin deficiencies and early onset of chronic hypertension, elevated cholesterol, and diabetes, something that I'm already seeing in my young patients. Ensuring access to nutritious foods is really a critical piece of a child's health. My colleagues recently published an op-ed in the Richmond Times-Dispatch this week, and it discussed the significant disparity in access to healthy nutrition many of our patients face.
Thank you, Dr.
We know that families often choose
please-
cheaper.
Could you please conclude? I think this bill is in very good shape, and we're
Yes.
likely to vote it
So-
out. So,
Perfect. So I really hope that you'll support this legislation, and nutrition is definitely a marker of our community's socioeconomic stability. Thank you.
thank you so much. Are there any additional speakers?
Yes, Madam Chair, we have Yeli Montano.
Okay. Please, we'll take
Hey,
the
good
next speaker. Please keep your comments very brief.
Yes, Madam Speaker. I just wanted to say I'm Yeli Montana with CASA Virginia, and we fully support this bill. I'd like to thank the delegate and other advocates for bringing this innovative public health initiative forward. Thank you.
Thank you so much. Again, to those, do I have anybody else in the queue? Okay.
Move to report.
Thank you.
Madam Chair, just real quick.
There must be a question. Senator Reeves.
Madam Chair, I want to tell the delegate, thank you for bringing this important piece of legislation. I think it's really important that we start driving our costs from acute care to preventive care, and this is one way I think that it will help identify that. My only challenge is we have a program called SNAP, and I'm not sure how that would integrate into this. I think it somehow has to integrate into this because SNAP, if you really look at some of the things that are issues with SNAP, it'd be great if they could be incorporated into this bill to help with that also. I'm just not sure how
I
that.
think Senator Reeves, and then I will respond, but I'll also ask David May to respond. You know, we did pass a bill earlier this year on the floor that expanded, it came before our committee, expanded the eligibility for SNAP up to the 200% of poverty. And this SNAP will enable more people to have the ability to purchase fresh fruits and vegetables. And we're hoping that with this program, maybe we can get actually Medicaid providers to provide fruit and vegetables in those neighborhoods. So it would be a combination. This will be adding to the supply. SNAP would be allowing individuals to purchase. So that's sort of how we think it's going to work, but the study may give us other ideas.
Madam Chair, they're at the table, and thank you, Senator, both of you. They're at the table, and they've been at the table in terms of the discussion. And so they'll be a part of the stakeholders that will help to move this and move it forward. Thank you.
It's a great question, though.
Yes.
Madam Chair.
Yes, Senator Kiggins.
Just had a quick question, and I know this
Sure.
bill is going to study, and I'm sure a lot of our questions will be answered during that study, but could you speak to maybe just the incentivizing of getting healthcare providers to use this program and the reporting back to the healthcare provider? Is there some sort of way to ensure that these fruits and vegetables, you know, it's hard to tell once we get them, how will we know that they've been actually consumed by the patients, and are there benchmarks that we're trying to set in order to improve health outcomes?
Madam Chair.
Yes, Delegate
Yes.
Quinn.
One thing, the study group that we are trying to establish in terms of creating the program that we're looking at, I think would be very effective in taking in all of those concerns, trying to dissect it to make sure that we will meet the commitment, the obligations, and the objectives. And I believe that while they're at the table, with everyone at the table, as Chelsea has said, that we have over 16 groups that are there who have had the discussion and want to see this move forward. So that will be a part of the overall objective, is how do we roll it out? How do we identify those who are most needed, the disadvantaged, marginalized, and to make certain that we are reaching across the board individuals who we want to move in the direction of a healthier lifestyle.
And one follow-up question, Madam Chair.
Senator.
So is the aim to have it be a healthcare prescribed program where healthcare providers will be dictating who is eligible, or is this going to be income-based, or do we know the answer to that yet?
If healthcare providers will be at the table, but we cannot leave out those who are, as it relates to income-based, because they too will be the targeted population. Yes.
Okay, thank you, Madam Chair.
Thank you.
I think we understand it. We're trying to look at both low-income populations as well as areas, communities. Any other questions, colleagues? I think this bill is ready to go.
Move to report.
Okay. Excuse me, go ahead. Who had the question? Senator DeStef.
Madam Chair, and I think the program concept is great. I just want to know how this is going to work in parallel with SNAP, because truly both groups, both a younger group needs fruits and vegetables as well as the elderly fruits and vegetables. There's a huge nutritional benefit for everybody on that. And I think if we're looking at this as part of an educational piece, then it's very imperative to understand better how it works with SNAP. Is it in line or parallel with SNAP, or is this completely separate from SNAP?
Madam Chair.
Delegate
Yes, Madam Chair, would you allow Chelsea Bennett, who certainly have been at the forefront in helping to move this forward, to come back and just respond to some of those questions? I appreciate it. Thank you.
Ms. Bennett.
Yes, good morning, committee. And again, thank you for the opportunity to be here. And so what we're looking at to answer some of the questions, yes, we're looking for this to be done through healthcare providers. So we're thinking about pediatricians, nurses, dietitians, those who will benefit. Our target goal, our target audience, it's Medicaid and CHIP patients. And one of the things that I learned is that not all Medicaid patients qualify for SNAP. And so there could be a gap, which we're looking to make sure that we fill with this program, as well as the reminder that as we're talking about this produce prescription program, we'll be targeting people with chronic illnesses. And so they will receive a prescription from their healthcare provider that will be targeted with them. We also have local programs here in Virginia that have done smaller runs of it. So we've seen that it can be successful on a smaller level, yet we are looking for this to be scaled statewide so that we can, again, help additional underserved communities, as well as those facing chronic illnesses such as hypertension, diabetes as well.
Great answer. And of course, they still have to have access to the food. So food needs to be in places where we haven't been able to access fresh food in the past. Colleagues, there was a motion. Tell me who made the motion. Was it Senator Reeves, and seconded by Senator Boysko? Okay, motion has been made and seconded. Clerk, please open the roll.
Ayes 12, noes 0.
Ayes 12, no 0. Okay. Delegate McQuinn, your bill reports.
Thank you. Thank you so much, and thank you, members of the committee.
Thank you. Who else? Do we have another delegate in the queue? I see Delegate Willett. Delegate Willett, welcome. Colleagues, please turn to House Bill 2070.
Thank you, Madam Chair and members of the committee. HB 2070 clarifies that community service boards may, and I emphasize may, contract with private providers to provide community-based services through STEP Virginia. This is not a mandate on CSBs, but rather clarifies that they may contract with private providers to meet the STEP Virginia goals. This will help to address the immediate needs of services by encouraging CSBs to partner with existing organizations who are able to provide these services. I was fortunate to be able to coordinate with the CSBs on this bill, as well as the private providers, and I think we have a good piece of legislation here, and I hope will be the will of the body to report this.
Okay, colleagues, this is a very simple piece of legislation. If you read lines 43 and 44, that's the legislation.
Madam Chair,
Or, let me see if there's some questions.
I just want to briefly speak to it when you have a... Madam Chair, I'd just like to thank Delegate Willett for this because, you know, STEP Virginia is a great concept and a great plan, and boy, do we have a long way to go to get there. And he has taken an approach working with the CSBs to determine how can he help. And I mean, we need more of that in every one of our communities. I have two of the finest in the state, and they're struggling to meet the requirements of STEP Virginia, is trying as hard as they can. So I appreciate Delegate Willett's focus on it. I know his volunteer work in his past dealing with free clinics and CSBs has been extraordinary and immense, and so I appreciate him bringing that to the General Assembly. Thank you, ma'am.
Thank you, Senator Mason. Yes, we certainly want as many partnerships as possible. Are there any speakers on this? This is a very straightforward bill, and I think it's about ready to be voted out. Are you okay with that, Delegate Willett, or would you like me to pause?
No, I appreciate that. I appreciate the
Move to report.
Okay,
regardless of what he says.
Senator Mason made a motion to report. Is there a second? Second by Senator Boysko. Will the clerk please open the roll? No.
Ayes 12, noes 1.
Who voted no for?
It looks like
Senator Spruill.
I apologize, Senator. It looks like we had a little bit of trouble with the voting board this morning.
Could I ask you to clear the board?
I will, pardon me.
Okay. May I have a motion to reconsider the vote? Okay. Because of this technical reason, I don't need a motion for reconsideration. We're going to take a second vote. Please open the roll. No.
Understood. With the understanding that Senator Locke votes aye, ayes 13, noes 0.
Senator Spruill. Is she a nay? Okay.
Pardon me.
Okay.
Pardon me. That'll be properly HB 2070 with the motion to report.
We thought it was
ayes 12, noes 1.
My apologies. Okay. Now we have.
Thank you, Madam Chair.
Oh, thank you. Your bill reports. We have 1874 with Delegate Coiner, and we also have Delegate Transbill, who is Delegate Coiner is in the queue. Colleagues, I draw your attention to House Bill 1874. Delegate Coiner, welcome.
Thank you. Good morning, Madam Chair. House Bill 1874 takes our good morning, Dio. House Bill 1874 takes our current screening process for those who may have mental health needs in our jails, and it would require upon that initial screening that within 72 hours, those with acute or deemed at risk of suicide would receive a full assessment. The bill further elaborates that the Board of Local and Regional Jails shall report back to the body by October 1st, 2021, with how we can achieve all of those screenings done within 72 hours between the screening and the assessment. We do know that the work that the Board of Local and Regional Jails has done has resulted in looking at most assessments being able to wait 7 to 14 days. And hopefully the work with this study would show that some localities can actually do all of their screenings within 72 hours, others cannot. And how do we achieve this statewide? What are the resources that are needed? I do have lots of folks who are willing to speak in support. They do not need to speak, but they're there if you need them as a resource. Thank you, Madam Chair.
Thank you, Delegate Coiner. I received, just for the purposes of my committee members, I received a positive comment from John Jones. Is he here with the Association of Sheriffs? Okay. Mr. Jones, would you like to speak to this bill?
Good morning, Madam Chairman.
Good morning.
I'm John Jones, representing the Virginia Sheriff's Association, and we're speaking in favor of House Bill 1874. This bill is a product of an effort by the patron, by the sheriffs, and by the Regional Jail Association to provide a safety net for those incarcerated in local and regional jails to get the services they need. We've worked hard to get the bill where it is, and we hope you'll pass it. Thank you, Madam Chairman.
Thank you. Are there other speakers?
Madam Chair.
And how many others?
I see one additional speaker, Madam Chair.
Okay, go ahead. Please call the next speaker.
Eugene Oliver, please go ahead.
Thank you, Madam Chair. My name is Eugene Oliver. I am president of the Virginia Association of Criminal Defense Lawyers, and we support this bill. This is an area where mental health is an acute issue in the jails, and this does take a strong step in helping remedy that issue. So thank you. We ask you report.
Thank you. Okay, that concludes our speakers.
Mr. Chair, Madam Chair. Speaking to the measure briefly.
Senator Morrissey.
Thank you. First of all, I want to thank Delegate Coiner for bringing this bill. It's a crucial addition to this particular existing piece of legislation that after you have a behavioral screening, that if there shows that there's some defalcations that you can get mental health services. The closest regional jail I think we have, Delegate Coiner, correct me if I'm wrong, is Riverside, and every jailer who is on the board, that's the sheriffs from the local jurisdictions, support this, realize the necessity of not only doing the screening, but then getting the actual treatment to the person. So I thank Delegate Coiner for bringing this bill, and I would be remiss if I didn't say that our chairman got to you in quick order as opposed to the 87 minutes that I waited this morning to get onto your subcommittee, Delegate Coiner.
Madam Chair, move the report.
My apologies for my members.
Second.
Move the report, Madam Chair.
Senator DeStef.
Madam Chair, I wanted to thank Delegate Coiner for bringing the bill as well. Our jails, as we know, are our largest mental health provider out there. I did have one question, and I'm just trying to alleviate having to fix an issue in the future. My question for Delegate Coiner, if I may, Madam Chair.
Sure. Senator DeStef.
If the jail has a mental health provider under contract or on staff, can that person conduct the assessment, or does it have to be done by an outside provider?
Delegate Coiner.
It does not have to be done by an outside provider. Madam Chair, it does not have to be done by an outside provider. It can be provided by whomever the jail is working with.
Great. And Madam Chair, just one follow-up question.
Senator DeStef.
Okay, for Delegate Coiner, and again, this is just to make sure we fix any problem that may come up later. If it's done by a private provider, who is responsible for paying that?
Delegate
Madam
Coiner?
Chair.
Yes, go ahead.
It is my understanding it's however the contract is being handled between the provider and the local and regional jail is my understanding.
Madam Chair.
Senator DeStef.
If I may, just speaking to the bill, the reason for the questioning is we've had an issue like this in the past that it's taken legislation to fix, but never really got fixed properly. I just want to make sure that, this can be done later, it can be done by intent, the attorneys can do what they need to do. We just need to make sure that if it's done by a private provider, then we know that the jails are paying for that private provider to handle the cost of this or associated with this. I just want to make sure we're clear with that so we don't have to come back and do additional legislation to fix it later. And with that, Madam Chair, I will be supporting this bill.
Thank you, Senator DeStef. I'm going to ask our counsel, David May. I don't have a note here that it has to go to Finance, so could you respond? I understand this to be like a study right now to ensure that the 72 hours assessment is met, but could you perhaps address Senator DeSteff's question.
Madam Chair, yeah, so as far as the finance issue, we won't be sending any bills to finance today. I think you said previously that you're going to straighten out Mike Tweedy, and I think you straightened him out. I think we do have a couple of fiscal impacts here, but there's been no request. As far as Senator DeSteff's answer.
Madam Chair, I'm happy.
Nobody could straighten out Mike.
Madam Chair.
He's a force unto himself.
Madam Chair.
Senator Hanger.
On that point, the last finance meeting was supposed to be yesterday, but we moved it to Monday, so that it is possible still to send them there if they need to go to finance. But I don't think this one.
The fiscal impact says there's not a fiscal.
No, I'm not suggesting this one go there. I'm saying if you have bills that have fiscal impact, they can go to finance.
Madam Chair, you don't have to send everything to finance. Good Lord, it's just a study.
Madam Chair, I just want to clarify my point here. It's not that this needs to go to finance. It absolutely positively does not. What I'm trying to clarify is if they're doing this as a study, then in that study, they have to address that the jail is responsible for paying for a private outside provider. It truly lays out whose the paying responsibility is. This in no way needs to go to finance within the General Assembly. It's just a point that this needs to be addressed while they're looking at it, so we don't have to come back and clarify it later like we have had to in some other bills in the past.
Would you concur with that assessment, Mr. May?
Madam Chair, so yeah, basically the local jails, a lot of them contract with the local CSB, and that's how this would work. That may not be the case in every situation, but if they do not have an in-house person, they are going to have to contract out, and it's going to come down to who they contract with. But I don't know. We could ask John Jones as well if he wanted to opine further on it.
And I think that may be something that can be worked out as part of the study, but I do think the end game here will be to get to the 72 hours. Yes?
Madam Chair, you're making this hard. It doesn't have to go to finance. You're making it hard.
No, it does not. It will not be going to finance, Senator Sproul. I think, Mr. Jones, did you have a comment?
Yes, ma'am, Madam
ahead.
Chairman.
Go ahead.
72 hours. Let me just say that most of the sheriffs are exceeding that now. Not exceeding, they're beating the 72 hours. And when we sent the bill out for review by the sheriffs, a lot of the sheriffs came back and said, we need to do this as soon as possible. So, and we're already paying for it. There are mechanisms in place. We have contracts with providers, private providers. We have contracts with CSBs. But keep in mind, the whole bill is a safety net. It's for the ones that we can't get to in 72 hours. We've got to do something. And those 72 hours is a way to move us along to make sure that these people get the service they need. In most cases, they're already getting it. And the sooner we get the assessment done, the better it is. It's better for everyone. It's better for the inmates, better for the patient. It's better for the administration of the jail. So just keep in mind, Madam Chairman and members of the committee, this is a safety net. We don't want to go past 72 hours. In most cases, we're already beating the 72 hours.
Thank you so much.
Madam Chairman,
if I can just follow up real quick.
We need a motion to report this.
Yeah, Madam Chair, I just want to follow up.
Senator
Mr.
DeSteff,
Jones,
very quickly.
Mr. Jones answered the question and the concern, which was the jails are already taking the responsibility for payment of this. So my concern was that we wanted to clarify who the responsible party for paying for this was. Mr. Jones already came on and said, hey, the jails are taking this and saying, hey, we're responsible for paying for it. That's how we're going to do it. I just want to make sure that that's how it is consistent and stays. My concern is I don't want this to ever be a food fight over who pays for this critical service.
Why don't we try to move this bill forward?
Move to report and refer directly to the Senate floor with alacrity.
Thank you. Senator Mason made a motion, and where was the second? Senator Boysko. Will the clerk open the roll, please?
Ayes 13, noes 0.
Delegate Coiner, your bill reports.
Thank you, Madam Chair.
Okay, the last bill on our docket is House Bill 2035. Patron is Delegate Tran, and it has to do with TANF and full employment. Is Delegate Tran in the queue?
Good morning, Madam Chair.
Good morning and welcome.
Thank you. Are you ready for me
Go
to
ahead.
begin? All right. You might hear the soundtrack of my life in the back with all my remote learners. But House Bill 2035 is a bill that I've been working with the Department of Social Services on. As you may know, in the TANF program, there's the Full Employment Program, which is an employment subsidy opportunity for TANF recipients. The current subsidy that it would be paid for employers to participate is pretty low. It's $300 a month. What this bill does is increases that subsidy up to $1,000 per month for a maximum of 6 months. And the TANF recipient would still be eligible to receive their TANF benefits and earn income while they are working on the subsidized job. I think this is really important as subsidized employment programs have shown to provide really vulnerable individuals with an opportunity to gain workforce experience and skills on the job training. As we are rebuilding our economy from this pandemic, we want to make sure that nobody is left behind. I think this is an opportunity for us to help our TANF recipients gain that valuable employment and training employment and training opportunities. And so the Department of Social Services projects that 200 participants per month will be enrolled in this opportunity, and a similar subsidized employment program in the state of Washington, which was a community jobs initiative, resulted in 72% of participants finding permanent employment afterwards. I welcome your questions.
Madam Chair.
It's a great bill. Senator Morrissey.
Thank you, Madam Chair. First of all, I want to thank the patron for bringing this bill, and what a common sense, practical, purposeful bill. Madam Chair, I know there may be a lot of speakers in there, but I would just point out that this bill squeaked through the House 99-0, and we could spend a lot of time debating it, or we could vote it out.
I think it's a very good bill. Are there speakers? How many speakers?
If you would like to speak to the bill, please raise your hand. I see 2 speakers, Madam Chair.
How many?
2.
Okay, there are 2 speakers. Clerk, go ahead and let them into the Zoom room.
Chloe Edwards, please go ahead.
I'd ask you to keep your remarks to a minute or less. I think the committee understands the bill, but we are pleased to have you participate in the conversation.
Thank you. Good morning. My name is Chloe Edwards with Voices for Virginia Children. We support this bill and agree that without policy preventions that promote financial and economic security in combination with overcoming poverty, families are presented with even more barriers. This bill will contribute to strong neighborhoods, families, and children. For this purpose, we ask that you to support this bill. Thank you.
Thank you. The next speaker, please.
And our final speaker is Mark Golden. Please go ahead.
Madam Chair, members of the committee, my name's Mark Golden. Can you hear me?
Yes, yes. Good morning.
Okay. My name is Mark Golden. I'm the TANF Program Manager at the Virginia Department of Social Services. HB 2035 is an administration bill, and we strongly support it. Thank you.
Thank you. Colleagues, do you have any questions? Okay, Senator Boysko moves to report, and Senator Mason seconded the motion. Will the clerk open the roll?
Ayes 11, noes 1, 1 abstention.
Delegate Tran, your bill reports.
Thank you.
Thank you. Is there any other business to come before Rehab and Social Services this morning? Hearing none. Okay, colleagues, this is our last meeting. We finished our work. It has been a pleasure working with you this session, as always. I think we should actually give our staff a round of applause. You've been great. And David May, you have gone above and beyond, and we can't thank you enough. All the rewrites you've done on the marijuana bill are much appreciated, and unfortunately, you're going to have many more ahead. But thank you so much. If you're all ready and willing to go have your tea or coffee, I think we'll just rise. And again, thank you. You're great colleagues.